just want to make your eyes hurt. It's actually a Brit video. They're the ones that do this kind of stuff. Okay, so we're going to do a little animation on stroke, and we're going to do some case studies on brain damage. So let's go back over here. Here we go. Courtesy of BBC.
A stroke occurs when the flow of blood to part of the brain is cut off. A stroke is a medical emergency, and urgent treatment is essential. What causes a stroke?
Good question.
To function properly, brain cells need a constant supply of oxygen and nutrients, which they get from blood.
Via the CSF, right?
When the blood supply to part of the brain is suddenly stopped, brain cells become damaged or die. This can lead to permanent brain damage or even death. Different areas in the brain control the function of different parts of the body.
And that's an important concept, right? If the brain was random, this would never make any sense. Because each part has a job for a location. If I damage that, I damage that job at that spot. And so that's why you can diagnose a stroke. If I know what your symptoms are, I know on the brain where it happened, because it's always the same place in everybody, more or less. Likewise, if I know what you're damaging, I can predict your symptoms, because it's the same map for everyone. Make sense? Mm-hmm. So the reason your nursing home job exists is because you can do that. You can see the damage and tell the person where they got the damage to the brain.
Each receiving its blood supply from 4 main arteries in the neck and their smaller branches in the brain. The level of brain damage caused by a stroke varies greatly and depends on the blood vessel affected. A stroke may go unnoticed if only a small blood vessel is affected. But if a large blood vessel is blocked, it may lead to long-term disability or death. There are 2 types of stroke. Ischemic stroke is the most common type, most often caused by a blood clot,
There it is. There's my Whopper with cheese.
or a piece of fatty material blocking an artery, restricting its blood flow. Hemorrhagic stroke is when the walls of a blood vessel in the brain become weak and burst, causing bleeding and brain damage. Transient ischemic attack, TIA or mini stroke, is similar to a stroke, but the brain's blood supply is temporarily blocked, and the effects of the blockage get better within 24 hours. The clot either breaks up quickly, or the affected area receives blood from nearby blood vessels. TIAs do not cause permanent brain damage, but are important because they are often a warning sign for a stroke. Other risk factors for stroke include increasing age, smoking, drinking alcohol to excess, obesity, diabetes, and high blood pressure.
Let's talk about your future in healthcare. It's going up because of this, right? Let's visualize. Half the United States is obese. Obesity creates type 2 diabetes, which raises your blood pressure, right? All right? Microbrews are everywhere in Portland. Pot's legal, and we're all getting older. So next time at the ER, count how many stroke victims are showing up at your nursing home or your yard. It's probably about half. Because as these demographics kick in, more people damage their brain and end up being your job, right? So that's the concept. So this is going to happen to a lot of people.
A healthy diet, stopping smoking, moderate alcohol intake, and regular exercise can all help to reduce the risk of getting a stroke. It is important to seek immediate medical attention if you have a stroke. The sooner you get help, the better the chance of a good recovery.
Looks creepy. Make sense? So stroke is we're killing off those brain parts. Those brain parts don't do their job. That's a stroke, or whatever you want to call it. Same thing with brain damage, right? Same kind of concept. So let's go to your packet of pain one more time. This time find the very first page in the packet of pain, which is Mr. Dexter. We're going to do a little stroke case together, because next week's quiz is this kind of thing. I want you to diagnose a stroke. We will figure out what brain part is affected, to figure out all this stuff you learned. Pull this one together. So, Mr. Dexter, Blah, blah, blah. One day, weakness on a side, confused, double, can't speak, stumbles, fall, expensive test. Number 1. What is a stroke? Tell me what it is. You just saw the animation. What is a stroke? Lack of blood flow to where?
The brain.
Lack of blood flow to the brain. We'll put that on the board. So, lack of blood flow to the brain. Look at the word in parentheses, which is Saladin's word. Can you tell me, medical scholars, what cerebrovascular accident means? Brain, blood vessel problem, right? So, lack of blood to the brain. Like they mentioned, brains need air. They need sugar. If you rob them of that, they die. So a stroke or is simply my blood can't get to my brain cells begin to die. So your job with your team, I'm going to give you 30 seconds, future nurses. Look at Mr. Dexter's case and tell me all the risk factors he has for a stroke. Start now. There you go. I've already bought my gravestone. Yeah. Family of 6 and a farm. There you go. You got it down.
Did you see this on article that were like talking about how they finally think that BMI is a really bad way to determine it?
Yeah, because
And I was
BMI
like, no
doesn't.
kidding.
There's no good way, right? Unless I kill you and melt you in a pot, there's no good way to calculate
But it was
body
just-
fat and muscle mass.
It was just funny. It was like, duh.
Yeah, because BMI, you can be really muscular and BMI goes high because it's just a weight per
Right,
unit.
weight to
So
height ratio, yeah.
you basically have to do a holistic approach. I have to weigh you, fillet you, I take all those numbers. Okay, let's go through it. So let's do an order. Risk factor, is being 52 a risk factor?
Yeah.
You bet it is. Over 40, right? Your warranty expires, so he's older than 40. Being black is a risk factor. Different ethnic groups have different rates. Blacks have higher strokes than whites. Well, there you go. I'm one of those. That's every husband and father. I'm doomed. Hey, yes, stress. How about his BMI? Obesity? We learned from the video. Obesity creates all sorts of problems, so that's a problem. Tell me what a high lipid profile means in English.
He has a lot of fats.
Crud in his blood, right? He has lipids. What did they do? They plugged the pipes. The pipes can't get to the brain. That's a risk factor, right? Hey, and the winner! Smoking 2 a day. There you go, right? So if you put those all together, he's a prime candidate like the video. He checkmark every single one of those boxes, right? So he's at risk for having his brain not get blood and get a brain problem. So we're going to do number 3 then. What are Brodmann areas? And how do they relate to this? Does anyone know what Psych 101, what Brodmann areas are? That's why I have a job. All right. These are specialized areas of the brain. That's creepy. So these are areas of the brain that have a specialized job. You've listed them over here. All right? So what do you think the Brodmann area of your frontal lobe is, the Brodmann job is? His job is to move my mouth and move my body. That's a specialized job. So these are Brodmann areas. These spots only do one thing or several things, right? So again, your brain is divided by job and location.
So it's just the different lobes.
Different lobes and different regions of the lobes. That's a Brodmann area. So if I put that picture back up, which I'm going to do next, right? Which is this one right here. Each of these colors is basically a Brodmann area, saying this part of the brain does this. This part of the brain does that. This part of the brain does that over there. And that's how you diagnose a stroke, because each area has a job. Make sense? So collectively, those are Brodmann or Brodmann areas. Your brain is not a generalist, it's a specialist. So, let's do number 4 and 5 then, about this collateral blood flow. It's on the screen. It was in the animation. Can someone remember from way back when what collateral meant?
Safe side.
Yes. Blood flow from other areas. Is that good or bad to get blood flow from other parts of the brain?
Bad.
It's actually good, right? So if I have a stroke like the TIA, I can get blood from some other brain area to feed the same cells. That's actually a good thing. You want more than one way to get blood to your brain. Now we're going to talk about the parts of the brain that do that. There's one in particular we're going to focus on this term. I'm going to show you a picture of the bottom of the brain, looking up at it. We're going to figure out what part that is. Right here. Right. Here's the bottom of my brain. I'm looking up from your neck into the bottom of your brain. Okay. So the blood's going to come up this way. Follow my finger. Hey, look, a roundabout. Blood makes a circle. Why would I want a circle of arteries in the bottom of my brain? Why do you have roundabouts now for intersections? You can keep things moving. So if someone's the jerks in that lane, I can go around and come back, right? Not that I have problems with this. Okay, so look at this. So if the green dot is my triple whopper with cheese, blocking that road, this blood can go on this side and still get over here. I can go around the blockage and serve the rest of the brain. That's a very good thing. What do we call that roundabout in your brain? Circle of Bruce Willis. Very good. Put that up there. So the circle of Willis is part of this collateral flow. It enables the blood to do multiple paths around the music. That's going to freak me out. There we go. So the circle of Willis is one example of a collateral flow. The blood can go multiple pathways to get to the brain. If you want to think of another organ that might have collateral flow, so if you block it, blood still gets there, your heart's a good plan. And an asthma, because if your heart doesn't get blood, you die. So having more than one way to get around the blockage is a good plan. So how does that affect this development of stroke? So collateral flow would do what to the incidence of stroke? More or less? Less. It's going to lower the chance of stroke. If you didn't have that, you'd have a stroke already. Okay? By having multiple ways to get around the blockage, my Whoppers with cheese don't kill me. Okay? That's a good thing. Make sense? So you want those. That's why they're TIAs, because they're not going to block forever.
So there are other parts.
Yes, we're just going to do the circle with us. But there's a lot of anastomosing, they call it. Right? So now here comes the fun part. Now let's focus on Mr. Dexter. Number 6. We have to do a functional relationship between two words you don't know yet. Okay, let's go through the Okay, Broca's area. That's a synonym. Broca means motor speech. So in this class, you can say Broca, you can say motor speech, I'm okay. So let's look over here. Which part of my brain does motor speaking? Motor mouth is where? I erased the frontal lobe. So the Broca's area is the motor speech in my frontal lobe. It's where I make my mouth go. Right? And its job is to make words. All right? Wernicke's, this one, it is to understand speech. So you can say Wernicke's, you can say understanding, they're kind. Which part of my brain understands the words coming out of my mouth?
Parietal.
The parietal lobe does. So this is going to be the parietal lobe part. Is to understand, or to, understand is the right thing. To comprehend, to understand what I'm saying. So there's different parts of your brain to make the words, there's different part of your brain to understand what the words are saying. So let's go back to Mr. Dexter. We have to figure out which one is busted in him. Let's go back up and do it together. Let's see. Okay. If we go here, his speech is slurred. What does that imply? Right, it implies he can't, can't get the words. Then go down here. He has difficulty articulating answers to questions he is asked, speaking only a few words. Right? However, his ability to respond to verbal commands is fine. So he understands what you tell him to do, but he can't answer the question. Therefore, he's breaking his Broca's or his motor speech. The words can't come out. He understands what you say. he can't tell you what he's trying to do. Called a Broca's aphasia, or Broca's problem, or motor speech deficiency. So he damaged his motoring part of his mouth because he understands you just fine. Make sense, the logic there? Okay. So there's different parts of your brain for understanding. Good. So if he damaged the Wernicke's instead of the Broca's, if he damaged the understanding, what would he have done? What would be different? He'd be talking, and what would you... Yeah, nonsense, right? He'd be just talking because he wouldn't understand the words. Well, I'm gonna do that. Ever read James Joyce? Right? Okay. Right. So it's just gibberish because it doesn't make any sense. The words would come out, but they don't make any sense. You don't understand the
Would
grammar.
you still think that he's saying what
Yeah.
he's actually saying then?
Yeah, because in his thinking, that's okay.
Right.
But to you, it doesn't make any sense. Right? So he has damaged his Broca's area, his motoring area of his mouth. Number 7, these are words from 231. Are his symptoms going to be ipsilateral or contralateral? Someone remind me what ipsilateral means.
Same side.
Same side. Someone remind me what contralateral means.
Other side.
Other side. So, which one is it? Contralateral. And how do I know that? Because the brain decussates with the body. It's going to be the opposite side of his body from his brain. Remember, the medulla oblongata crosses the wires. So his symptoms are going to be the opposite side of his body from the brain part that's damaged. Make sense? Okay, your job. If this were a quiz, would be do number 8. Based upon all that, we're going to walk through what parts of his brain were damaged and how we got that. So I'm going to lead you through the garden path here. We're going to start at the beginning, again, and list every part of his brain that was damaged. Here we go. Let's start at the top. Mr. Dexter. All right. Weakness on right side. What part of his brain, what side of his brain would be damaged if the right side's weak?
Left.
We now know it's his left brain because of the decussation rule we're going to learn. His left brain is damaged. One thing down. Okay. Confused. Well, I am. Okay. Sees double. What part of his brain would be seeing double? Occipital lobe. Because occipital is where I make the image. I'm making 2 images. Speech is slurred. We learned that. Which part of his body does the slurring speech? I erased it here. Frontal lobe. Because that's where you're motoring your speeching at. Is that even English? All right. He attempts to walk, stumbles, and falls. Frontal could work because frontal does motoring. So it could be frontal lobe again. Could be cerebellum, right? So tell me what the cerebellum's for again. Balance. So that's not real concluded. It could be he couldn't walk well, or it could be he couldn't balance well. I don't know what the answer is, so we'll leave both. Now, in the ER, right hemiparesis and diminished pinprick 2-point on the right side. So what does that mean in English? He can't what? He can't feel where?
Fingers.
On the right side of his body, therefore we damaged his what? His left. What lobe would be feeling? His body. Parietal. See how we made that connection? The side and the body part. The left parietal would affect my right body feeling. Okay, we'll skip the reflex one for just a second. Blah, blah, blah. We did this one already, frontal lobe. Okay, so we break this down. We know his stroke was on the left side of his brain. It affected his occipital lobe, his parietal lobe, and his frontal lobe, possibly cerebellum for lacking balance. That'd be an A answer on a quiz. Make sense? That's your goal for this week. You're going to practice that skill. I gave you symptoms. Can you track down parts? I gave you parts. Can you give me the symptoms? Right? That's your goal. See how I did that? Just break it down logically, side, position. Questions on how I did that? All right, yes?
I mean, is that massive ischemic stroke? It's affecting all those regions?
Yes.
I mean, 'cause is
It'd
that-
either be one real big one or like several big ones all hit together. Because you can do that. You can have a clot hit, it breaks off part of a clot and goes over here and clots that. Deep vein thrombosis, a lot of times with that, multiple clots break off and hit all at one time. Or it's just a really big stroke. Okay. Make sense? Logic there? Okay. So we figured out what we think he has. Now we're going to do number 9. Remember, I mentioned his reflexes were brisk. What does brisk mean in doctor speak? Excessive, too much. So brisk means they were excessive. They went too far. So your reflexes were hyper-reactive, too high. So tell me about this brain motor areas if your reflexes are overexcitable.
Exaggerated movements.
It means these are damaged.
Oh.
Okay, so let's go back and figure out why. When I hit your knee at the doctor's office, why don't you kick the doctor in the face? I mean, your knee's
Control
going.
it.
Why don't you just keep going?
You only go so far.
You only go so far. Why don't you keep going?
Because your brain tells it to only.
Your brain tells your leg to eventually stop kicking, right? So you're going to kick reflexively. The brain will then override that at the end and tell your leg to go down. I've now destroyed his motor part of his brain, so the spinal cord can do whatever it wants. So you can just keep kicking, right? Next time you're on the farm and you behead a chicken, you understand this concept. You cut that off the chicken, what did they do?
Run around.
They run around and fly even faster than before because their brain can't tell them not to. So the reflexes keep going excessively, right? So if his brain is damaged, his spinal cord can do whatever it wants as hard as it wants, right? The brain isn't there to check or overrule. So his reflexes will be bigger because his brain can't tell it not to motor. Make sense? All right, so let's do number 10 then. Tell me what plasticity means for no cost. What does that mean? New pathways, it changes. The brain finds new pathways. You do old skills with new parts of the brain. So tell me what career you're going to go into to help people do that. Occupational therapy, right? You teach the stroke victim how to use their legs and arms, and their brain has to learn a new part of the old skill using the new part of the brain. The part that's dead is dead. You're teaching the other parts to do a new job, which requires skill, right? The fact that you're learning anatomy is because your brain is plastic enough to learn new information and put on the old, right? That's the logic. So you have to teach the brain to use other parts to do the same tasks. Make sense? I'll give you a quirky example. This is bizarre. I had a friend of a friend kind of thing. He was 17. He had cancer in his shin. So what are they going to do to cancer in your shin?
Cut back.
Cut off your leg at the knee. So he has no knee. He's 17. So what they did was they took his foot and his shin, cut off the top of the shin with the cancer, turned his leg over and put his foot where his knee used to be. So his leg is on upside down. And then they did therapy to teach his brain that that's his knee and not his foot. So the part that was his foot part of the brain became a knee part of his brain, and he walks fine. It's amazing, right? So you can do that. You can teach the foot part of the brain that's now a knee, right? Right? You can do that. It worked.
Can you bring a photo next time?
I can ask. Right? Let me show you another view of that. Remember this picture? The creepy people inside you picture? Last time, I think it was this class, we had a phantom limb presentation. Remember that? Mm-hmm. Okay, so you get your arm amputated, but your arm still tickles, even though there's no arm there. Why does that work?
Because the pathway is still there and it's still.
That's right. The brain still has a map for your arm. So the brain still assumes your arm is there, even if it's not, and it tickles. So what you're trying to do is make the brain say, no, the arm is not here. The arm is somewhere else. Or the stroke part, your hand's not here anymore. Put the hand over there. You're trying to teach the brain to move that information to a different location. That's the plasticity. That's why you recover from strokes. If I train you hard enough, your brain will figure out a new place to walk from. Right? That's plasticity. So you know that from your patients. If you teach them, the stroke will eventually, hopefully, they'll regain those skills. Make sense? Right. Except for my dad who had 5 strokes and refused to have physical therapy. He's an idiot. All right. So do a counter side of a stroke. Damaging brain, damaging parts. So now you're on your own for some more. So I'm going to give you some practice. So go in your case study packet one more time. And turn the page as brain damage practice. We're going to do the first one together one more time. And the other ones will be for you. So, everyone find it? here's this woman, blah, 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 has all these problems. Paralysis of right face and arm, loss of sensation, can't answer, blah, blah. So let's do number 1. Based upon these symptoms, it asks what artery is blocked. Well, you don't know that yet because I haven't taught it to you. But now we're going to learn. You're required to know at PCC which cerebral artery goes to which part of the brain. Okay? So you can love me later. I'm going to show you a picture showing the cerebral arteries and where they serve in the brain. So let's look at this picture. Those colors represent cerebral arteries. Where do you think cerebral arteries are found? In your head, in your brain. Yes, good. Each one is servicing a different part of the brain. So these are the blood vessels that carry your blood to the brain to feed it. So if you block one of those, you're going to affect certain parts. So you're supposed to know which blood vessel goes where, thou shalt. Let's do that together. With the hot erasers. Let's start with the blood vessels. So they're named front, anterior, middle, and posterior. Let's do the anterior cerebral artery. That's it. So looking at that picture, it's yellow. What lobes is the yellow part on? Frontal is a good choice. This is the front. And parietal, right? So your anterior front tube does 2 different places. It does the frontal lobe and some of the parietal lobe. It's being serviced by the anterior cerebral artery. Let's do the middle cerebral artery. I'll use ignore the man behind the curtain. I'll use the middle. That's the red one. Can you tell me where the red one is going?
Temporal.
Temporal lobe.
Occipital.
So that's temporal lobe is kind of here. And part of the frontal too, isn't it? You can do that. Can someone tell me why it's good that they go to the same place? 2 different blood vessels go to the same location?
If you get a blocked it.
That's right. If one gets blocked, I have another way to get blood there. It's that collateral concept. So they're going to overlap. So let's do our last one. Sorry. The posterior. Looking at the blue, where are you, Mr. Blue? Temporal and occipital lobes. So you have 3 different tubes that service basically the lobes. There's some overlap. Temporal gets 2, frontal gets 2. There's actually more overlap than this, but for our class, this is fine. All right? But thou shalt know that, thou shalt, because on our case study, we're going to use that information. Question on that? Let's go back to our case study. We got to figure out what cerebral artery is blocked. So to do that, we have to figure out what's wrong with her where. Paralysis, meaning I can't move my right face and arm. I can't move will be what lobe? Can't move. Frontal lobe. Okay. Loss sensation. I can't feel. What lobe is feeling? Parietal lobe. I think I'm a winner. All right. And those, let's see. I can understand but can't speak. That's the frontal lobe again. So, looking at the check marks, what single artery is the most likely to have been affected?
Anterior
The
cerebral.
anterior, because it affected the frontal and parietal lobes. If I block this tube, it would hit both of those. Does that make sense? Okay, so for answer number 1, it's her anterior cerebral artery. All right. Why was she paralyzed in the right face and arm? Because it damaged which lobe and what side? The left frontal. Because frontal does motion, left does right, because of the decussation pyramids. Her language disorder. Which part of her brain was the motoring or the understanding that was damaged in her?
Understanding.
Let's see. She can't answer but understands, therefore her damage is in the motor, the Broca's. So you're going to say the motor speech part. Or you can say Broca's aphasia. Fine. She can't make words. Notice she can write fine, but can't say it. Different part of the body. So we figured out it's her front cerebral artery. The left frontal got nailed, why she can't move her right body. Because of that, she can't make words. Make sense? Your job, and the next 3 case studies are on your own. I'm going to give you 10 minutes. Do case 2, 3, and 4. Find a friend and see if you can do it.